guys, it's Dr. Palm at Art Skin MD. We're going to make this quick, but we wanted to give you a little lunch and learn. So we're going to give you a tour. It's Virtual Summer Skin Rescue. It's been running since last week. Tomorrow is the last day. So we thought we'd spend some time with some of my staff and actually go through some of the products and some of the devices that are offered in these specials. If you have questions, want to know where this is, if you look at our website and hit blog, the most recent blog history has all of the specials listed, has links to all the devices, so you have information on that. So we thought we would start with one of our really popular body contouring machines. I've got Ricky Hoppy with me, who is one of our amazing non-invasive body contouring experts. You've been doing this for over a decade, haven't you, or close to?
Yeah, body contouring in general,
yeah.
I have, yes.
And we are very fortunate. Some of the before and afters of the original Emsculpt that was used in a study are actually Ricky's before and afters. She's very talented and I think sophisticated in her approach to non-invasive body contouring. So Emsculpt NEO, I'll maybe have you explain it, Ricky.
Yeah,
tell us about like what the two different technologies are.
Yeah, absolutely. So we have, this is the Emsculpt NEO, and today we're showing the Edge. So this is the newest applicator that's out. We're honored. We're one of the first practices to have it. And basically what this is treating is the flanks kind of into this abdominal cavity area here. So on the flanks, we're using just RF, so really targeting basically fat reduction in that flank kind of hip area. And then it's contouring into, your abdomen here, which is treated with the HIFEM technology and then the radio frequency. So the HIFEM, of course, is giving you those muscle contractions, helping strengthen your abdomen area. And then the RF, of course, is also treating the fat as well. So this is a very exciting applicator. I mean, for us, we're like I said, honored to have it. Danny's getting a treatment today. Really minimal discomfort, right, Danny? Yeah. Everything's feeling okay. You know, you feel those muscle contractions, you feel the warmth, but very comfortable overall. As you know, we've been doing this for a while. We have the one for the abdomen. We have one for biceps and triceps. We can do outer and inner thighs. Front, posterior, anterior thighs. So we have a lot of applicators here. But this is our most exciting. So, otherwise, as a series, you come once a week.
Circumferentially treat the abdomen. So, we could treat the abdomen and tone the muscles and help with fat reduction.
Absolutely.
But we didn't have something, we've got Coolsculpting, which is fantastic, but now we have the ability with HIFEM and RF technology to go after the muffin top and almost like a little clam here, just on either side, and that's why it's called the Edge. It gets the edge of our waistline. So, really excited about this. I've had one treatment. I need to be better about getting on that, but I've had a series of Emsculpt NEO treatments and really like the results. As someone who is tall and working over patients constantly, just having a strong core. Absolutely. I think as much as I love the aesthetic benefit from it, better muscle tone and decrease in fat, I really love the fact that I actually feel better. Like my yoga sessions are easier, doing planks, doing my sit-ups are easier. And then just, I lean over people all the time and I'm doing this all day. So the ability to have a strong abdomen, have a strong booty, I think is really important.
It helps your back. For your job, it's the benefits are
So 4 sessions about once a week. That's part of the special. And you certainly can treat abdomen, buttocks. We now can treat the flanks with this. Arms are very easy to treat. And inner thigh, I think that's been a challenging area. Even though we can reduce fat, this actually helps the skin quality, I think, a little bit, even though that's not on label. It helps the muscle tone a little bit of fat reduction, but that area we want to be very careful of, and I think this is a great opportunity to be able to tone sort of the inner thighs. I also wanted to go over, we've got several really amazing raffle prizes, so please comment on our Instagram Live, and we will randomly select people for several of the raffle prizes we have. This is one from Elastin, and it's got all of the goodies. Elastin is based off of trihexpeptide technology. It gently builds collagen, builds elastin. Georgia is a big fan of it. As you can see, she loves Elastin products.
She looks.
I know. She's every day. Look at her lustrous fur. And then with Emsculpt NEO, with Coolsculpting, any body contouring procedure, we really recommend this Body Transform. So that would be something that Ricky and Christy would talk to you about during your consultation. It enhances fat removal and helps with collagen and elastin generation. We do have several injectable packages going on, both for myself as well as our PAs, Stephanie and April. So very popular is buy 3, get 1 free with our sculptor packages, and that's definitely been like a hotcakes item for some of our patients. And then we also do something called a Restylne Enhanced package, and we can mix and match 4 different syringes. You buy 3, you get 1 complimentary. So just really nice, I think, offerings. It's the best offers that we do through the season. We just want to thank patients for their loyalty and give them a little savings going into fall. So we're going to leave our Emsculpt NEO room. We're going to go next door. And we're going to go to one of our 2 Ultherapy gurus. This is April DiMaggio. You guys may recognize her. She's an amazing PA, and she is like just tears it up with our Ultherapy. So maybe you can give just like the 30-second sort of elevator pitch about what exactly Ultherapy is.
Well, it's micro-focused ultrasound technology, and we are able to actually treat what we're not able to do with other devices, and that's one reason why I really love this, is it will get down to that muscle layer, and we can lay down that ultrasound technology to help with laxity, muscle laxity in particular, and tightening of the skin. So I was going to feature the specific area here where we're able to give a little bit of a brow lift. And what I hear a lot of patients' concerns daily is that they've noticed that their brow used to be kind of on top of that brow bone, and it's just started to sink down, and it makes them feel kind of heavy. So it's a great technology to be able to address both that muscle laxity, but also get into the dermis more superficially and stimulate collagen growth, and that just helps give it some support. So this procedure, when I'm doing just this focused area, takes me probably about 20 minutes to do. I'm able to keep her very comfortable with just some topical numbing and injecting a little numbing dot, just like going to the dentist, so she really isn't feeling much of anything. And then I just go ahead and lay down those lines. So I read the ultrasound here on my screen. I can see exactly where I need to go. And then I just fire those little lines right over the treatment area. How does that feel, Judy? Is that okay?
Yeah, it's fine.
Yeah. This is something, like I said, that takes 20-25 minutes. It's something you could do on your lunch hour. There's really no downtime at all. You could go right back to work. You're able to, because it's non-invasive, you're able to put your makeup right over top of what I'm doing. With a lot of procedures, not able to do that. So it's quite easy, quite painless or comfortable, and quite effective.
That's awesome. And, you know, we know from the original studies that was done by another dermatologist, Murad Alam in Chicago, it lifts the brow by, on average in the clinical studies, 1.7 millimeters, which may not sound like a lot, but around the eye area, it's a big difference. Particularly women notice that when putting on their makeup. For our specials for Ultherapy, we have full face and face and neck. Those are, I would say, the most common packages that patients select. We're showing you just a quick area, which the brows is included in full face treatment. You know, really, what I like is there typically isn't downtime. We do a lot of things differently here to make sure that patients are comfortable. I think if you do some reading about Ultherapy, you want to make sure you have the right provider that in real time is looking at the tissues, is able to target both the mass as well as the dermis, and not target things that we don't want to, like the fat or, you know, surface of the skin. And then you want to make sure that the patient is comfortable. So we do a lot of sneaky things. I know we're just talking about doing topical, but we do a lot of things and talk to patients during consultations to make sure they're super comfortable and that this is something that I think yields really nice results, but we also want to make sure that it's a pleasure to do. And then in this room, I wanted to show you some of our other raffle prizes. So Restylne is a company from Spain. It's Catalonian. And they have some great products, not only a sunscreen that's mineral-based, but that has a plant-based DNA repair enzyme. So I recommend it a lot for patients with sun damage, patients that have had a history of precancerous or skin cancers. And then they also have something called melatonin, which contains an Asian plant and seed called bakuchiol. It acts like a retinol, but doesn't have the irritating and redness effect that some patients experience on retinols and retinoids. So it can either be used on its own, and it's actually been shown in clinical studies. There's just another article published in the last several months talking about it to treat acne the way we use retinoids, to help with anti-aging, to even help a little bit with precancer spots. But I actually pair it with my retinoid, and when we do that, you get synergistic effects with less sort of irritation. So that's this package, sunscreen and the melatonin. And then we have a wonderful package from NeoCutis. This is a growth factor line, so very gentle, even on the really sensitive skin types like rosacea. Growth factors help encourage and build new collagen, and actually been shown to build a little bit of elastin too. So you get all of the best products. Bio cream, which I love if you get a burn, a scrape, anything like that. I've had many patients I've used this, and it helps skin heal in a really phenomenal way. Journée is a tinted sunscreen, and it's got the growth factor in it. Bio Serum is quite similar in formulation to Bio Cream, but has 2 times the number of growth factors. So I always tell patients, if you want a more potent one to use on the face, I love Bio Serum. And then their Lumiere Riche is wonderful. It's anything that's got the firm in it in the NeoCutis line, which is what we're carrying out, not only has the power of growth factors, but also has the power of peptides to very gently but effectively build collagen. Final sort of filler package I wanted to get to, we've talked about the Restylne package. This is the second one that we'll feature, is our Radiesse and Bellatero combo. Radiesse we use oftentimes to inject on label in the jawline to help with definition. I don't really like the term snatch jaw, but a lot of people like to say that on social media. So it helps with sort of jawline formation. We've got some great photos in some of our email blasts that have been going out. Bellatero, I really enjoy using. We're actually seeing great results off-label in the tear troughs. I use it for fine lines in the neck area. I use it on label around the lips for fine lines, and I think it's a great product for that. So the other area off-label I use Radiesse quite a bit is for neck rejuvenation. So after doing Ultherapy with April or Stephanie, oftentimes patients will come back to me and we do a little what we call Radiesse wash. So using very blended down Radiesse in this area of the neck, and it helps the skin quality and actually helps sort of shrink wrap it a little bit. So you get the dual effect of something like Ultherapy, skin tightening, and then you're getting something like a collagen stimulator like Radiesse. So we're finished in this room. Thank you, April, for helping out with that demo. We're going to move to our third and final room, and we're going to show you a couple other technologies. So maybe start with Coolsculpting first.
Sure.
You want to do that, Christy?
Absolutely.
So this is Christy Cashman.
Hello.
She is our other fantastic non-invasive body contouring expert, and she actually teaches at Coolsculpting Academy. So she helps new Coolsculpting technologists help them with techniques, gives them their educational background. So we're super lucky to have her here. And she's going to actually explain cryolipolysis to us.
Right. So this is one of my favorite technologies, non-invasive body contouring technologies. Basically, it's FDA approved to remove excess fatty tissue in 9 different areas of the body. And what we're doing is basically freezing those little excess fatty tissue areas, so diet and exercise resistant areas, and we do the freezing, and then your body takes over and does the rest. So now is a great time to get started for looking good for the holidays, because it does take about 3 months to see your final result. But again, we have all different applicators for our different areas, different sizes. So I would love to help anyone with their body
and usually it's like
goals.
a couple of cycles, right?
It's at least 2 for your average patient. You want to do 2 sessions at least a month apart, and then about 3 months after that final session is where you see your final result.
Well, and that's great. I've had treatment. I'm busy, but boy, things change in your 40s.
They do.
And you start to get little areas and pockets of resistance, and people are like, really, Melanie? but we do. So, I've had both of you guys, both Ricky as well as Christy, treat me in areas. So I've had like a little bit of bra fat treated.
Yeah.
I've had my lower abdomen treated just to keep that taut and toned and, devoid of excess fat. And then more recently, my flanks treated. And so I think this is a great complement with the Emsculpt NEO. So we sometimes debulk the fat and then start to tone afterwards.
And that's what I was going to say, is that we can actually do some volume reduction with this, and then do a little bit of sculpting with this, then truly get some good sculpting and toning with the Emsculpt NEO. So it's a great combination.
And we have this nice TV, so literally when I've had the opportunity to do it over lunchtime or after hours, it's like you get to Netflix and chill, watch some Selling Sunset or some sort of fabulous Netflix show. So thank you, Christy. And again, this is, we've been a part of studies where using that elastin body transform with something like Coolsculpting, we enhance fat removal by 30 to 50%. So I know that sounds like too good to be true, but we always, always, always recommend that topical treatment, and I think we see nice results and enhanced results because we're actually using that as a combination topical therapy. So in our packages, we have IPL and Resurfix, and we also have IPL and Legend Pro. So Stephanie Williams, who's our newest addition, practitioner-wise, I wanted to be able to introduce you guys if you haven't had the opportunity to meet her. And she, along with myself and April, we love this machine as sort of a skin booster. It helps with hyaluronic acid production, with collagen kind of glowing up. And I think it's really nice to be able to combine it, if appropriate, with an IPL to reduce the brown and the red. And then we use this as sort of a minimally invasive way of sort of helping with skin texture. You know, I've had several of these. I think both Steph and maybe April too. Both of you guys have done this on me. You know, and minimal downtime. I've done it on a weeknight, and I've been able to come back here tomorrow. 24 hours later, I can put on makeup. Pretty minimal downtime with it. You know, just a little bit of brawniness. You'll look a little sunburned after treatment. But Steph, maybe you can say, like, how frequently do you see patients, and, you know, in terms of a package, what do you recommend?
Yeah, absolutely. So we like to recommend a series of 3 or 4 spaced about a month apart to see your results. It helps really beautifully with acne scarring, reducing acne scars, helping with skin elasticity and like building collagen and elastin in the skin. It helps with fine lines and wrinkles. I love the radio frequency technology because it can actually go deep into the dermis to help heat the tissue, and it gets better results than just plain microneedling, the mechanical stimulation. And it's very well tolerated. As you can see, I have my patient Nayeli here. We just put a little topical numbing on her, and she's doing really great. I love the radio frequency because it also helps with downtime. So it's less red and irritation. So patients who kind of have to go back to work, or they want something with a quick downtime, this is an awesome option for them. We also, like Dr. Palm was saying, pair it with some of our other technologies like IPL, which really helps with redness and hyperpigmentation. And you can do it all in the same day. So it's kind of nice to add on. So we love it.
Yeah, and you know what's nice about this is it combines 2 different technologies to kind of trick the skin to build collagen. So there's a mechanical stimulation from the actual microneedles, but out of each of these needles, when we actually fire this device, is radio frequency being emitted, and so that creates bulk heating of the dermis, which builds collagen, helps with appropriate fibroblast activity, and a little bit of hyaluronic acid production. So we really like this. Radio frequency is relatively what we say colorblind, so we could even use this on African American skin. You can use it on Caucasian skin, and it's a very safe procedure if done with, you know, reasonable settings. So this is one of our newest additions. It's actually new this year to the Summer Skin Rescue. It's certainly popular. I think we've had several patients treated even this morning. I know right before we went on, we were using this on a patient. So definitely get rave reviews from this. I think it's an easy way to glow up with minimal downtime, especially with things like the holidays coming up and people want a little pep you up. I think it's a nice thing to offer. So we're going to go next door, and I'll finish up with a couple of the raffle prizes. And then in this room, just wanted to feature one of our last raffle prizes, next to last. It's a revision kit. So you get the C-correcting lotion, which I absolutely adore. It's got a special form of fat-soluble vitamin C called tetrahexyl decyl ascorbate. It's highly absorbed but less irritating on the skin. So we've actually been a part of their clinical study and have shown that redness is reduced while pigmentation is improved and skin texture is improved with this. We also have the papaya enzyme cleanser, which just is a nice way to kind of keep skin glowy and tends to be gentle on the skin. And then also in this is Revox. So I actually slather this all over my face every day. It's a great complement to things like Botox, Dysport, and Xeomin. It's actually got neuropeptides that have been shown to relax the skin. So there was a study done with just Botox on one side and Botox and the Revox on the other side, and there was a greater relaxation of the crow's feet using the combination treatment. So I love, love, love this. Either if you're not ready for something like Botox, but want something topically that mimics it a little bit, I think this is a great option, or you can use it to complement around the eyes, or you can even use it on the full face like I do. And then we do have a Juvederm package. So the Juvederm products include Juvederm Ultra, Juvederm Ultra Plus, Volbella, and Velour, and we have Voluma as well. We're just not showing that. And these are products that are tried and true. We've had for a long time, and they're fantastic and very versatile depending on what we're choosing. Some of them we use for lip augmentation. Some of them we use for mid-face enhancement. The lower third of the face, I think, is an important area, especially in women. You can see I'm talking a ton. It tends to be an area that's very dynamic and tends to age a little bit more quickly, right, Georgia? And so this is a great product to be able to sort of compare these, mix and match for them like we do with the Restylne package. And so if you've used things like Voluma, Juvederm, Velour in the past, that might be the package for you. So finally, we're going to move out of here and just go over the couple of last raffle prizes. I would be remiss without recommending Color Science to some of my patients. This is a mineral-based sunscreen, and they've got lots and lots and lots of different products that I love. I love their sun-forgettable brushes. This is something you can take on the go. I have them in my compartment, like my little driver's compartment in my car, and I sort of redust myself if I'm driving home. In that is also, oh, I love these. So let me actually show you guys this up close. But these Sun-Forgettable Total Protection Color Balms. So you can give a little rosiness to your cheek. You can use it as a lip balm. There's actually colors that actually look good on the eyes too. There's like a bronzer. So you get that free in this raffle package. And then also the Total Eye Contour Kit. I love the little eye masks that they have for this. They've got under eye pads that come with this. And then the applicator is sort of a metal ball, so it just soothes and it's so nice. And you get that as a part of this raffle package with Color Science products. And then finally is our Art of Skin package. And this includes everything that's kind of our most favorite products from this line, including the vitamin C, our neck and décolleté cream. You get our body wash with that, as well as the eye cream. So please comment. We'd love to hear from you. If you guys have questions, we're closed from 12 to 1, but we'll reopen soon, and you certainly can find more information out about our packages if you go to the blog on our website, so artofskinmd.com. And then next month, we're going to be talking about a very fun device. So this isn't part of our specials, but if you are interested, please ask, and we certainly can set up a consultation with one of us to talk about M-Face. But we'll do a separate little post on this. And it is HIFES technology. I know, Georgia. So it combines high-intensity, focused electrical stimulation as a way of muscle toning for the face. So it's the first time ever we can actually tone muscles, because just like on our body, our muscles become atrophic. The same thing happens to our face. So we'll talk a little bit more about this next month, but we can use it on the forehead to help with wrinkling. Believe it or not, if we build the muscle, it actually reduces some of the forehead wrinkles. It lifts the brow, and then we can treat in the cheek area to help with vectors of the face and help with the jawline. So we'll definitely do a little special about that next month, but just wanted to go over the packages. Wanted to thank everybody for being a part of the Art of Skin MD family. Call us after 1 if you're interested in things. Georgia wanted to make her voice known, so she's very happy now that she's a part of the crew. But wanted to thank Christy, Ricky, Stephanie, and April so much for demoing some of this and being a part of the Art of Skin MD family. So with that, we'll say goodbye. Bye, you guys. Thanks for tuning in, okay?
And now, right?